Good morning, everybody. It is February 8th, 2021. I was realizing I haven't really sent in a lot of updates on anything. Um, I've been off treatment from the Tepezza infusions for thyroid eye disease since October 7th, 2020. Um, I would say that greatly improved the bulging within the first two infusions. Tepezza is the only medication that is available and FDA approved to treat thyroid eye disease. And anyone who has thyroid eye disease knows how debilitating it can be. If not, there's no cure, but you could easily lose your vision if you're not receiving any sort of treatment for it. And it's pretty difficult to deal with, on top of the fact that if you have it, you're also working through like some serious thyroid related problems, which affects your endocrine system, your neurologic system, your respiratory system. Like, the thyroid is a central gland in your body that controls your hormones, your cortisol. It works in tandem with your brain to, trigger your body and how it reacts to things, stress especially, and things like that. So having hyper or hypothyroidism and having and or Graves' disease and or Hashimoto's and or the many other thyroid related issues is a daily challenge, and it's hard to not suffer from depression and a lot of other things that go on. And I think that having the pandemic and lockdowns and things for the past almost year and a half now on top of it, I guess technically a year in the United States, but the virus has been around longer than a year. Um, it's just been a struggle, I know, for most everybody. I can say that I feel like I've come through most of the pandemic pretty um, unscathed as far as like catching the virus. So far, I was blessed enough to be able to get both doses of the vaccine. We did realize that it affects people very differently. My partner got it, and he had severe flu symptoms within 24 hours. He had a fever that lasted a couple of hours. And then 48 hours later, his lymph node under the armpit of the arm where he got the second vaccine, like, just blew up like a balloon and hurt a lot. And it's almost 4 or 5 days later, and that's still a major issue. But we looked up that that's something that is actually common among a certain percentage of people who have gotten it, and it often gets confused for like breast cancer in women who have mammograms who have had their second dose. So I guess that's the only issue with the vaccines, is because they're so new and they were kind of rushed. We don't have enough long-term efficacy, which is why, I get the debates for getting it or not getting it, and, letting people do what they want. However, it's still good to ensure that we are wearing our masks, distancing from people we're not living with regularly, still maintaining those three basic: washing our hands a lot, using sanitizer. It's still important to do those things. I feel a little beat down today. That's kind of been the new norm. My blood tests for my thyroid, my TSH, my T4 have been normal. For my thyroid, every day I take Armor Thyroid, which is a form of desiccated pig thyroid pieces and parts. Um, it's the one of few total thyroid replacement medications out there. I was originally taking levothyroxine when I was hyper, and then I think they had me on it for a little bit when I became hypo after a total thyroidectomy, or having my total thyroid removed a year and a half ago. However, having had my thyroid removed I just feel like it's been a downhill battle because the hypothyroidism is far, far worse than the hyperthyroidism. Granted, both have their benefits and down pitfalls, but I think I enjoyed the hyperactivity and the just the energy levels I had under hyper, because I did so much more, and now I feel like a sloth most of the time on a good day, and so that shift in my energy is a huge difference for me. However, my doctor recently recommended going on something called the ashwagandha extract, and hopefully in a couple weeks I'll see if that's helping me. I'm taking 500 milligrams once in the morning, once in the afternoon. That's supposed to help with my cortisol levels, which have been low. So even though my TSH is off, I don't generally go by the TSH because a lot of doctors, for some reason, only test like the T3 or the T4 and the TSH. You really need to get all three tested, along with, your cortisol levels and your hormone levels, and request those full blood panels, because when you're dealing with thyroid related issues, even though your TSH and T3 and T4 might be okay, you still might have like deeper thyroid issues that you need to deal with, such as cortisol being too low. I also am iron deficient anemic, so I have to take iron pills. Like, it's crazy the amount of things I have to take every day. But, luckily only 2 of them are prescriptions. Everything else is kind of natural remedies and helpful allergy medication and things like that. So, for the most part, things have been good. We had our second vaccine a week ago or so, a little less than a week, and I feel like I'm doing okay. I know the second dose is supposed to be way more of a doozy for people than the first. I have to say, my sister and I did not have that experience. The first actually hurt our arms for like 3 or 4 days after, like really sore. But it stayed concentrated to, within a foot of the injection site on that arm. And then the second one, the pain lasted just for a couple of days, and I have had some like mild irritation and a couple of headaches, but nothing like my partner, who was like in bed just sweating and with a fever. So, everybody handles all these things a little bit different. So I just hope that people won't be afraid to get the vaccine, so that, when we're out and about, like, if you do get it, it won't kill you. Or if you're out and about and get COVID, it won't kill you, but you do have to realize you still need to maintain those masks and safety mandates so that you're not infecting other people and possibly killing your friends and family, because that's probably a guilt that nobody really wants. Unfortunately, this virus is definitely showing us our weaknesses. It's showing us our class inequities. It's showing us some of the major issues that have been ongoing, but like are more placated because of the virus, and how we need to go about fixing a lot of the things going on, even in the United States right now. I am grateful that things are starting to get better. I'm hoping that, the pandemic will be over before the end of the year. Even if it's not, I'm grateful for the time that we've had going through the pandemic to really be able to focus on more of these health issues that have popped up and are continuing and ongoing for the rest of my life without having a thyroid. My thyroid eye issues are extremely minimal. Again, I've been off of the Tepezza treatment since October last year, and let's see, November, December, January. So that's almost 4 months ago. My vision is it's only got slightly worse, but that was because between when I got thyroid eye disease initially and actually getting treatment for it was a bit difficult, because doctors were fighting me on it being thyroid eye disease for 6 months. I did have some permanent vision defects because of that weight, but I feel like my vision's good. I don't have a lot of bulging. I would eventually like to get the surgery to kind of get the, they call it a blasphrotomy or something like that, to get rid of all this excess skin that you can see. I don't know. It just bugs me maybe more than other people, but I have excess skin that kind of keeps me from being able to see up and to the sides better. But, those are just minor issues versus actually being able to see and drive and not be blind. So I'm grateful for those opportunities. I'm grateful that I had state insurance when I was unemployed and fought them for 3 or 4 months to get that approved, because Tepezza is super expensive. You're looking at over $200,000 for treatment, and a lot of insurance companies are not wanting to fit that bill when the general consensus is that ocular surgery or surgery on your eyes is a better fit than paying $200,000 for a series of 8 injections. It's really sad that it generally comes down to money, and how, just that our healthcare should even that shouldn't even be a question. Like, it should just be available to people, and not about making money or making people like have to worry about being denied for treatments that they need. So that's just a whole nother issue is with our healthcare and insurance systems. But anyway, I guess I just kind of wanted to update, let everybody know I'm okay. I apologize for not really posting a lot. I feel good now that I'm vaccinated completely. I'm hoping to end this isolation here in the next few days a bit more, and get out in the world and kayak and all that stuff again, and get off this 20 pounds that I've gained from sitting around. I look forward to working back in the office again sometime, or probably working remotely mostly, and then at the office a couple days, doing hybrid or something. And just getting back to my life, feeling better, my friends, and focusing on the positivity that the relationships and the environment have in it, and staying positive and optimistic about everything going on in the world. So that's all I've got to say. I don't have more to add. Hope everyone's doing well. I hope those that are dealing with these thyroid issues, are hanging tough and doing their best. Be sure you're getting your blood tests, every so often. If you have more severe issues, probably every couple. So it's 6 to 8 weeks. I was getting mine done for a long time. Now I just get it done once every 2 or 3 months, which is for some still a lot. But, I feel like when you have thyroid issues and you're feeling off, like, it's important to know what's going on so that you can treat it and not feel like a slug every day. So, and those working through thyroid eye disease, like, know that, there's opportunities out there for Tepezza for you. The manufacturer has some interesting financial programs in place to help people who get denied treatment be able to cover it through grants or scholarships, and some really interesting programs like that, at least in the United States. I don't know about abroad, but I know I've gotten a lot of questions about the medication, and I know from my experience I felt like I had pretty minimal side effects. I felt like the bulging got better within about 6 weeks. It was probably closer to 4.5 or 5 weeks. My vision got better at about the same time. Again, the only difference is now I have to have a prism value in my eyeglass prescription. I won't go into what that is, but it's necessary for an astigmatism. And other than that, things are good. I hope everyone is doing well. I will post more as we go along, weird videos of whatever's going on. And wishing everybody a great February and Valentine's Day, and be safe. Maintain your COVID related stuff, but don't let it keep you isolated. And yeah, reach out if you have questions or need any answers, or I don't know, anything. Thanks for subscribing and listening to my rambling. Have a wonderful day. Thanks. Bye.